Now I'd like to introduce our third panel of witnesses, Tom Fuller from New Brighton and Deb Waldin from Edina. Both Mr. Fuller and Ms. Waldin are former Fairview patients. Ms. Waldin and Mr. Fuller, thank you so much for participating in this hearing and for sharing your stories. I know that is not necessarily an easy thing to do. My main goal here is to figure out whether existing law is adequate to protect Minnesotans like you when you go to the hospital. I also have a lot of questions about the evidence. That's why I asked Accretive and Fairview and the Attorney General so many questions about the exhibits, the reports, and the legal filings. But look, it's really important that we not lose sight of the human element of this. So I'd like to hear about your experiences with Accretive and Fairview. So I'd just like to ask you some questions, and Ms. Waldin, I'll start with you. I understand that you visited Fairview's emergency room in July of 2011. Why did you go to the emergency room that day?
That evening I started...
Can you talk a little closer to the mic, I think?
Sorry, I'm new at this. I started experiencing some pain in my side that within an hour just went off the charts with pain. So I had a friend take me to the emergency room at Fairview Southdale. She dropped me off, and I stood in line waiting for triage. I was in so much pain that I arched to the front of the line and said, I need help here. I need some help right now. And he got a wheelchair. He put me in a wheelchair to the side, and I waited there for maybe 10 minutes. And then someone came and took me into the room in the ER. I was put on a gurney. By that time, I was just with debilitating pain. I was in a little ball in a fetal position, wishing I could die. This ultimately ended up being a kidney stone, which, if anyone's experienced that, it's terrible pain.
Well, you say you're in pain.
Yeah.
Doctors sometimes use a scale of 1 to 10. On the scale of 1 to 10, what you're experiencing.
I wouldn't be exaggerating if I said a 12.
Okay.
It was bad.
Now, had you been given any pain medications, anything
No.
to relieve the pain before you were
No.
approached by a billing employee?
No. They started me on a morphine drip afterwards, but I had not seen a doctor yet or had any kind of pain meds.
So, okay, so you're writhing in pain on the gurney, and you're approached by a financial counselor. Was anyone with you when you were asked for payment, or were you alone?
No, I was alone.
Okay. How did you feel when the man came to your cot and asked for the payment? Did you feel vulnerable? Did you feel scared? How did you feel?
Yeah, I saw out of the corner of my eye, I saw this little guy wheeling a podium with maybe a computer or something on it. I wasn't sure. And I was just having such pain, it was hard to process what he was saying, but I do recall he said I needed to pay him between $700 and $800. And I think it was like $750 or something. And I couldn't believe he was asking me this at the foot of my bed as I'm laying there. And I said, I have insurance. I don't know what you're talking about. And to be clear, I didn't have any debt with Fairview. I didn't owe them any money. I had no debt with them. And he was asking for this money right then as I'm laying there, and I just ultimately told him to get out of the room and go away, and he did.
Okay, now, as best you can recall, understanding you were in a great deal of pain, had you been seen by a doctor at that point?
I don't believe I had been.
Okay.
It seemed like a long time that I was waiting for a doctor, but long time when you're in that kind of pain can maybe not be that long, I'm not sure.
Okay, now, did you have medical insurance?
Absolutely, yes.
Would you have paid your bill even if you had not been approached
No, I
in this vulnerable state?
I did pay my bill, yes.
Okay. In fact, okay, you did pay it when you were back
Yes.
at
yes,
home.
Yes.
Do you think there's a better way to collect payment from patients and the way you were treated in the hospital? In other words, do you think trying to collect from patients while they're in pain in the emergency room is a bad policy?
Yes, I think it's a very bad policy.
Did you complain to anybody about the way you were treated?
Yes, I did. I called a couple days later. I called Fairview and talked to maybe some patient representative. I'm not sure who it was. And she didn't really have an answer for me. It sounded like she didn't know what I was saying almost. And I didn't get nothing happened from that. She just kind of poo-pooed it. And then Fairview sends out a survey, at least to me, maybe a week or two later, to fill out your experience. And without a doubt, the doctors and nurses were fabulous, and I want to make that really clear, that they were wonderful to me.
I'm sorry, so you were satisfied with the care that you got from the doctors and nurses?
Once I got that, absolutely. But I did write on that survey that this man had come in and approached me under my circumstances that I thought was just terrible.
I think that is very important, that you're very satisfied with the doctors and nurses at Fairview.
I think they're getting a bad rap, the whole Fairview is, and the doctors and nurses were great.
Thank you. Thank you very much, Ms. Waldin. Mr. Fuller, I'd like to ask you similar questions. Can you tell us about what happened when you visited Fairview Hospital in November of 2011?
Well, I had been going to the hospital there for 3 years. Never any problems. Lung transplant.
Maybe put the mic a little closer to you so we can all hear.
I had a lung transplant in January of 2011, and I had many complications throughout the year. So when I went in for this procedure in November of 2011, I still really wasn't totally with it. And my wife had been taking care of all the financial ends of it, and she was there every time I was at the hospital. On that day, I checked in at the front desk, and they always do all the check-in right there, put the little bracelet on your wrist and sign the waiver. But this particular time, the person at the front desk said that so-and-so will be checking you in. I thought it awful weird because for 3 years, nothing like that had ever happened. And as I was being held, guided back down a hallway, my wife got up to join me, as she always has, and the nurse says, no, you'll be okay, you don't need to be in there. And they took me into a small little office, about 10 square feet it seemed like. The gentleman checked me in, as usual, printed off some papers, signed the waiver forms that are protocol, and then the last thing he did is he put another piece of paper in front of me, which was a bill for $500 and some. And I said, what's this? And he said, well, we need to pay up on your outstanding balance. And I said, outstanding balance? I said, we paid over $10,000 in this year, and we had gotten a bill the past week, and our balance due was $380. And we were unaware of any past due amount. And I just felt badgered, and it just got extremely upset. Finally, he said, well, I'll take a check or a credit card, however you want to pay it. And I said, I have no intention of paying you anything right now. I'm going in for a procedure. So he put, on the bill, he put Accretive's name, number, and another name for a person to talk to. I went out of the room, and everybody in that waiting room knew what happened in that room. I was shaking, I was furious. Just nobody at that point should be going through that. And my wife, she called the guy in the paper, and they got home, and she called him back, and they went through it, and he kind of agreed that one of the charges on there wasn't correct. But finished my procedure and went home.
Now, you had undergone a lung transplant,
Lung transplant, yes.
so you were vulnerable. I mean, you were weak at this point,
I
right?
had many side reactions all year long from the medications.
And I understand you, they knew about your condition, obviously, from your medical records. So they should have been aware that you were in a compromised
definitely.
state. I understand you had visited Fairway many times before. About how many times?
Starting October of 2008, I can't probably, leading up to the transplant, I bet you 50, 60 times a year.
Had anyone ever demanded that you provide a credit card to pay a bill when you came for a scheduled procedure before
Never.
this visit? No.
We stayed, we had payment plans, and we stayed on top of it. We were never late with the payment. We made a payment plan of a certain amount that in a bad month, if we couldn't pay the whole bill off, we had a cushion to go back on, but we paid the bills every month. And we, to our knowledge, we were satisfied. We only owed $380.
Now, I understand you had asked for your wife to come with you. Why was that?
Because of the state of mind of where I was at the whole year, I needed a second set of ears with me at most times.
So,
And they said that she didn't need to come in.
okay. So how did you feel during this? When you were taken to this back room and pressed for a payment, did you feel like you were being shaken down?
I was outraged. I was shaking. I was just totally upset.
Did you feel like the conversation with the financial counselor was optional? In other words, did he tell you that you didn't have to have that conversation?
No. I was told to come back to this back room, and he went through the normal spiel of checking in, and without losing a breath, he put the bill down and started asking me for money.
Setting aside your experience with debt collections, how was your experience with Fairview? Were you satisfied with the care that you received from the nurses and from the doctors?
I can't express enough the care that I received there. Doctors, nurses, coordinators, food service people, housekeeping. I spent many weeks off and on in the hospital, and now that's what really bothers me, because it's a great facility. The people there are fantastic, caring, and the people that had to talk to you, like on the phone, you knew they didn't want to be saying what they were saying.
How are you doing now? How are you feeling? I mean, this lung transplant, I can't imagine. That'd be like you were going in for a trach, replacement of a trach tube or something like that day?
No, it was a feeding tube.
A feeding tube. I'm sorry, a feeding tube, of course.
Have not traded out.
Yeah.
I'm
How you doing?
doing better.
Good, good. Well, thank you both very much, Mr. Fuller, Ms. Waldin. Thank you for being here today and being willing to testify. You're now excused.
Thank you, Senator.
Okay, would the last panel come forward, please? I'd like to introduce our fourth and last panel of witnesses. Jean Ross has been a registered bedside nurse for nearly 40 years. and is a member of the Minnesota Nurses Association. She was a nurse at Fairview Health Services and now is co-president of National Nurses United. Michelle Goodwin is the Everett Fraser Professor in Law at the University of Minnesota and holds joint appointments at the University of Minnesota Medical School and the University of Minnesota School of Public Health. Professor Goodwin is a prolific scholar who focuses on the role of law in the promotion and regulation of medicine, science, and biotechnology. And finally, Jessica Curtis is the Director of Community Catalyst's Hospital Accountability Project, where she advises consumer advocates and policymakers on hospital financial assistance and community benefits programs. Prior to joining Community Catalyst, Ms. Curtis provided legal services to low-income elders at Boston College's Legal Assistance Bureau. Thank you, Ms. Ross, Professor Goodwin, and Ms. Curtis for joining us. Ms. Ross, please go ahead with your testimony, and please do keep it to 5 minutes. Thank you.
Senator Franken, thank you for holding this important hearing on behalf of patients, family members, and nurses at Fairview and all over the country. My name is Jean Ross, and I am a registered nurse. In December of 2009, I was elected co-president of National Nurses United and currently still hold this position. Previously, I worked as an RN for Fairview Southdale Hospital in Edina, Minnesota, for over 35 years. The following is my personal account of 2 different incidents involving the Fairview healthcare system in the past 2 years that affected my family and me. In 2010, my infant grandchild was very ill over one weekend. On a Friday and then again on Saturday night, I accompanied my daughter and the baby for separate trips to the emergency room. This was at Fairview Ridges Hospital in Burnsville, where he was eventually diagnosed with encephalitis or meningitis and was then transferred to Minneapolis Children's Hospital. Our time at Ridges was made especially jarring, however, by the actions of some ancillary personnel who had nothing to do with the care of our young family member. My daughter was extremely worried. She had many questions, but she was holding up pretty well until I left to use the restroom. When I returned, she was holding the baby and sobbing. I assumed she must have received some very bad news about the baby's condition. Instead, I learned that while I, the nurse, and doctor were out of the room, a woman had come in and asked if my daughter was willing to pay all or any part of her bill now. My daughter told her no, she could not. As background, my daughter and her husband are among many families hit hard with medical bills and changes to insurance coverage. She certainly did not need reminders of her financial position while under the stress of worrying about the condition of her youngest child. Now fast forward to February of this year, my same daughter's just delivered her 3rd child at Fairview Ridges. Within 24 hours, a Fairview representative visits in her room with the goal to extract some or all of the payment for the bill. According to my daughter, this woman at least was apologetic. She even confessed, "This is the least favorite part of my job." Senator Franken, I spent much of my time at Fairview Southdale working in the ER. While there, I witnessed no such behavior. This kind of, I call it ruthless corporate behavior, just wouldn't have been allowed. A nurse's main focus is to advocate for patients and families. We urge patients to put other worries aside and to concentrate exclusively on healing. They certainly don't need the added burden of being pressed for payment while they're being treated. Every nurse wants to be proud of the work we do. We expect policies that allow us to do our job properly. We want to be able to speak well of the place that employs us. Programs or policies that encourage or require bill collection while a patient's being treated are, I believe, unethical and don't belong in any healthcare setting. It does not reflect well on any institution, and I'm very disappointed in the system that employed me for so many years. I'm even more aggravated at an overall healthcare system that doesn't allow universal access to all who are vulnerable, and which drives providers to this misguided and disgraceful behavior. This is exactly why our trusted and proven system of Medicare should be expanded so every man, woman, and child could be included in Medicare for all. I thank you for your time.
Thank you very much. We'll handle that last part in a different hearing, I think.
Just a hint.